Good morning, good morning, good morning, good afternoon, good evening, depending on where you are viewing. I am Mama Nurse Worldwide, and I do video on health tips. Today, I want to trash hypertension, the causes, what you can do, even the organic treatments that you can use. I won't mention drugs, all that, because I'm not advertising any medication, and I am always against self-medication. Now, hypertension. Hypertension is one of the diseases of the cardiovascular system that are termed cardiovascular diseases. These diseases of the heart are grouped as disorders of the heart. Cardiovascular system is like the pillar that holds your life apart from God. God holds our life, but cardiovascular system is like the pillar that holds our life, sending what the whole body cells. You know, we human beings, we are made up of cells. So the cardiovascular system send what the whole body cells need into the system and sending out what the body doesn't need, e.g. getting oxygen and nutrients, and removing waste like carbon dioxide and all the rest. Taking care of your heart with exercise, a healthy diet, controlled blood pressure, and controlled cholesterol. The waste that can be removed includes carbon dioxide, urine, sweat, etc. Hypertension is described as persistent or intermittent elevation of systolic arterial blood pressure above 140 milligram of mercury, or diastolic pressure above 90 millimeter of mercury. Best to target is always bringing the pressure less than 140 over 90 millimeter of mercury. Hypertension is high blood pressure, and blood pressure is the pressure of circulating blood against the walls of blood vessels. Most of this pressure results from the heart pumping blood through the circulatory system. That is, when used as a layman language, but the term blood pressure refers to the pressure in a brachial artery, where it is most commonly measured. In the cardiac cycle, it is measured in millimeters of mercury. Above the surrounding atmospheric pressure, or kilopascals. The difference between the systolic and diastolic pressure is known as pulse pressure. Please share this video, like this video, comment on this video, and follow. This will elevate the business. This will make me to continue to give you lowdown on how you can care for your health. The average pressure during a cardiac cycle is known as mean arterial pressure. Normal resting blood pressure in an adult, normal resting when you are an adult and you are taking your blood pressure without any stress. Approximately 120/80 millimeter of mercury. In men globally, normal blood pressure is 127/79 millimeter of mercury, while in women globally is 122/77 millimeter of mercury. The average data may change regionally. When blood pressure is too low, it is called hypotension. But consistently high above normal of like 120/80 or 127/79 or 122/77 millimeter of mercury, as mentioned, anything above this is hypertension. Anything below is hypotension. But some people have their normal that doesn't disturb them, doesn't do them anything. But yes, we still, once it's below or above global acceptance, we still term it as hyper or hypo. Now, causes of hypertension. When an individual has high blood pressure, there is need for medical attention. Mama Nurse Worldwide health tip is always against self-medication. Please, self-medication kills. Don't do self-medication. Go and see your health provider. There is need for you to seek medical attention when your blood pressure is high. How would you even know that your blood pressure is high? Without measuring the blood pressure, you can't know. You just be having symptoms. Orí ń fọ́ mi, I'm having headache, dizziness, my eyes are turning. Some people will say go and take blood tonic, go and use one something or the other, and it's your blood pressure that is rising. And blood pressure, if you don't know, my people, is a silent killer. What do I say? Silent killer. Blood pressure, high blood pressure is a silent killer. Low blood pressure is a silent killer. You must monitor your blood pressure. Because people who have it are sometimes symptoms free. You can be symptoms free. Prolonged blood pressure elevation eventually damages blood vessels throughout the body, particularly in target organs such as heart, kidney, brain, and eyes. Target organs. When I say target organs, those are the organs that made us human. Those are the organs that when they are good, when they are working well, we are good to go. Our heart, our kidney, the brain, and our eyes. Malignancy can raise your blood pressure, like tumors, chronic kidney disease. If you are overweight, obesity is an additional cause. Sleep apnea, this is a very serious disease. Some people will sleep, they will think they are sleeping, and they have already gone. But in sleep apnea, they will die and they will come back. Some people will say, how does that happen? It happens, especially with those. Go and read over it. Sleep apnea. Sleep as sleep, then apnea, apnea, that it is a serious sleep disorder in which breathing repeatedly stops and starts again. It happens more in men, and most victim doesn't know of it. They don't even know that mo mà ti kú mo tún jí, mo ti kú mo tún jí, I've died and I'm awake. They won't know, and it's a serious disorder. Some men have it more than women. When you are careless with your health, anything can happen. Then thyroid problems, diabetes, sensitivity to salt intake, people with less physical activities, people that don't get enough good quality sleep. That one is different from sleep apnea. That's in medical we call it insomnia. You don't have, you're on bed, you couldn't sleep, you just be rolling. Some people, when they stand up and maybe will have a cold shower, or they may have beverages, they will sleep. So that one is sleeping disorder. It's different from sleep apnea. People with less physical activities, just sitting down, no physical activities, people that don't get enough good quality of activities, is being physically down. It is not good. Smoking classified as main cause of hypertension. Overweight in an activity. Overweight and inactivity. When you are overweight, it affects you. Children too get high blood pressure, but it's not common. Age is an added cause. Sex, either man or woman, male or female, also influence blood pressure. Now, let me go to classification. The risk of cardiovascular disease increases progressively above 90 millimeter of mercury, especially among women. Blood pressure fluctuates from minutes to minutes, and normally shows a circadian rhythm over 24-hour period, with highest readings in the early morning and evenings, and lowest reading at night. Is associated with a greater future risk of cardiovascular disease, and there is evidence that nighttime blood pressure is a stronger predictor of cardiovascular events than daytime. Blood pressure changes in response to temperature, noise, emotional stress, consumption of food or liquid, dietary factors, physical activity, changes in posture such as standing up, drugs and diseases. All this mentioned, alters our blood pressure. The variability in blood pressure and the better predictive value of ambulatory blood pressure measurement has led some authorities, such as the National Institute for Health and Care Excellence, NICE, NICE in the UK to advocate for the use of ambulatory blood pressure as the preferred method for the use of ambulatory blood pressure is the preferred method for diagnosing of hypertension. Yes, I think you can take that. Ambulatory blood pressure is the best, is the preferred to get if you are hypertensive, if you have hypertension or you have hypotension. I'm taking the two together, hypertension and hypotension. When your blood pressure is too high, it's hypertension. When your blood pressure is too low, it's hypotension. Now, readings of blood pressure. Any reading that is 180 plus over 120 plus millimeter of mercury is hypertensive crisis. Once you have 180 over 120 millimeter of mercury, you are having hypertensive crisis. If you have 140 plus 90 plus 140 over 90 plus millimeter of mercury is stage 2 hypertension. 130 to 190 over 80 to 89 millimeter of mercury is stage 1 hypertension. Some people will say, if I have 130, I'm good to go. Yeah, you are good to go, but you are in stage 1 hypertension because you have already been elevated more than the global standard. 120 to 129 over 80 millimeter of mercury, and we will say elevated blood pressure. The real normal is anything that is like 120 over 80 is normal blood pressure. But in some people, up to 130 over 80 is still normal for them. But you have to see your doctor, your nurse, or any medical person that you check your blood pressure from. And those that you complained to when you at times have some complaints, when you have some complaints, so that they will view you, they will assess you, they will know if your blood pressure is too high or too low. But the readings must always be recorded. It's not that let me just okay, these people that are hawking about with speak, let me just take my blood pressure. You do, even from here to there, you have forgotten. Record it. So that recording will make your health provider know if it's sometimes higher or lower. Classification. Hypertension is classified into 2 types, namely primary essential and secondary non-essential hypertension. Primary essential hypertension accounts for over 90% of cases and is often referred to as idiopathic, since the underlying cause is not known. Once the underlying cause is not known, is referred to as idiopathic. Secondary non-essential hypertension occurs from a number of conditions that impair blood regulation and accounts for only 5% to 8% of all cases of hypertension. I mean secondary non-essential, which is non-essential hypertension, occurs from a number of conditions that impair blood regulations and accounts for only 5% to 8% of all cases of hypertension. Malignant hypertension could result from either secondary non-essential or primary essential hypertension. The malignant hypertension could result from either type and can cause blood pressure as high as 240 to 150 millimeter of mercury, which is getting to the level of being higher killer for that person. Common occurrences: cerebrovascular accidents. Stroke is a common occurrence. Impaired kidney function due to sclerosing, hemorrhage, or thrombosis of the renal arteries, which destroys functional tissue. When your kidney is impaired, it's like, I don't know, I'm always tired. This headache, it doesn't go. When my urination have challenge, because you have been so careless with your health. Retinal hemorrhages occur frequently with edema of the optic disc, leading to degenerative changes in the eye. Thickening and sclerosis of the coronary arteries, angina pectoris or coronary occlusion, in addition to the myocardial hypertrophy. All these things I'm mentioning, when you don't take care of yourself from the root, when you don't know whom you are, when you don't know whether you are hypertensive or you are hypotensive, all these common occurrences will be mounting until it becomes big. And at the end, death. Death occurs due to malignance. That it will lead to intracerebral hemorrhage. God forbid. Most especially when high blood pressure is not properly cared for. The above hypertensive complications happen and mostly leads to being handicapped or death. God forbid. God forbid. Please always check your blood pressure. Always check your blood pressure and record it. Take your record book to your health provider. They know what to do. Stop self-medication. Somebody sometimes says when the blood pressure was high, he uses one drug, one medication, and me too, let me go and buy it. That's not how to go about it. The best way to go about it is to have your medical practitioner and listen. When they talk to you, you listen. You take to their advice, and that one will help you more. Clinical manifestation, how you will be feeling when your blood pressure is high. You will be feeling tired, fatigue, reduced activity intolerance. If you are the type that can walk from here to there, from there to here, can do this, before you do small thing, you are tired. Before you walk a little, you are tired. Something is happening. dizziness. You just be feeling dizzy. You just be feeling dizzy. Something is happening. Palpitation. Your heart will be doing. Angina. Dyspnea. Occipital throbbing. Headache. Occipital throbbing headache. Especially on wakening in the morning. You are sleeping. You have slept. And you wake up and you start having headache. Frontal headache. No. You must know that something is happening, and uncheck mostly is this blood pressure. Vomiting, restlessness, emotional instability or epistaxis. Pathological changes in the kidney reveals increased blood urea when you go for test. If you are running away from your health practitioner, if you are running away from your hospital, if you are running away from your clinic, how would you go and do test that you know that your blood urea has increased more than normal? Nitrogen and serum creatinine levels may manifest as nocturia. Cardiovascular involvement will manifest. Brain cerebrovascular disease with headache, reported temporary paralysis on site, hemiplegia. Hemiplegia, temporary paralysis. It is then that hand, you won't be able to move your hand. You will now be tilted to one side, and your leg, you'll be dragging it. God forbid. God forbid. Cerebral infarction accounts for most of the stroke in transischemic attacks in hypertensive patients. Now let me quickly give you the medical management. In managing cases of high blood pressure, the health worker, nurses, doctors, etc. must be in agreement with concerned patients. The medical practitioners must be in agreement with their patients. The patients must be in agreement with their when you are not in agreement with with the person that is taking care of you, definitely the care that person is trying to give you may not work. Initial diagnosis of hypertension is made on the basis of 2 or more elevated blood pressure readings. It's not that you just do one, it's not that when you just take one, it's not that when you just take your blood pressure once and you assume that you're having high blood pressure, no, or low blood pressure, no. You take the blood pressure many times, supine and sitting, obtained at least on 2 or more separate occasions. If the first 2 readings differ more than 5 millimeters of mercury, additional readings should be obtained. Pastoral blood pressure should be measured in older adults. Comprehensive history taking, also comprehensive physical examination is done. Thus, fundoscopy of the retina may reveal hemorrhage. Laboratory investigations is your care provider that will tell you the test that you're supposed to do. we have some complementary and alternative medicine for blood pressure that I will give you, like acupuncture, magnesium, omega-3, vitamin D preparation, garlic, green coffee extract. My channel agrees for questioning. You can send your questions through comment section and I will answer you. How to use all these things like moringa tea, ginger tea, philanthus, nerumi tea, lemongrass tea, turmeric tea, cinnamon tea, and so on. Please share, like, and comment. Through your comments, I will answer your questions. Bye.